So, what could this mean for Hilary's ongoing health during the presidential campaign? Dr. Martin Saweirs is a GP and advisor to the medical helpline. Dr. Mortons joins us now. Hello to you, Doctor. Thanks for joining us. So, talk to us about pneumonia. We're told that Mrs. Clinton has walking pneumonia. That presumably means there are several types.
Yeah, so we as doctors generally categorise pneumonias into whether they're caught or acquired in the community, so at home, or caught or acquired in a hospital, and that generally divides how we treat them. And the community acquired ones, which is what I assume Mrs. Clinton has acquired, is relatively easy to treat with antibiotics.
Okay, so how long does it take to recover?
So usually a course of treatment lasts around a week or so. After that they're reviewed, seeing if any more is needed, and depending on the severity, the recovery can be anything from 2 weeks to around 6 weeks.
What about if you're 68 years old and you're crisscrossing the United States on a daily basis?
Sure, so obviously having a hectic lifestyle, having all the pressures upon you that Mrs. Clinton does have will take its toll to some extent or other, but she will be well used to that, and I would imagine that she'll have excellent medical help and will hopefully be back on her feet quickly.
But it's going to be pretty exhausting, presumably, having pneumonia, whether you can walk with it or not. And we saw what happened to her yesterday, where she literally, I mean, if she didn't have that support, she'd have hit the deck. Is that pretty common with walking pneumonia?
Yeah, that's pretty common. I mean, what you've mentioned initially about the symptoms and how quickly they can come on, that's absolutely the case with pneumonia. You can go from feeling pretty well to feeling pretty unwell very rapidly indeed. And it's not always clear what the cause is to start with until pneumonia is diagnosed. But once the antibiotics start, generally the improvement is fairly rapid.
Okay, what can go wrong?
Well, it's a long list of things that can go wrong. Pneumonia's hopefully and ideally are nice and simple to treat. You give the antibiotics and hopefully things improve over the course of a few days. But sometimes we don't know exactly what bug is causing the infection. We may need to change antibiotics, we may need to instigate some other treatments, but usually within 7 to 10 days things are well on their way to recovery.
You're giving us a positive spin on this, aren't you? It is just slightly, presumably her family must be quite anxious given her age, and of course, you know, the older you get, the more difficult it is and the longer it takes to recover from serious illness. And I guess that we're calling pneumonia a serious illness.
Yeah, pneumonia is a serious illness, it is indeed. And you're right, the older we get, the older everyone gets, the more prone we are to picking up infections and the harder it is to fight them off. The complications, as you alluded to earlier, can be very serious, but I think that given she's been deemed fit to be at home, to be walking around, I think the doctors looking after her are more than happy for her to have antibiotics in that setting, and if anything were to go wrong, I'm sure she'll be being kept a close eye on.
Okay, great to talk to you. Thank you very much indeed for joining us. Thanks a lot.
My pleasure. Thank you.